This is the second workshop in our day-long series. The title of the series is Managing Emotions in Teens, Responding to Dysregulation and Challenging Behaviors. My name is Carrie Michaels, and I work with the Children, Youth, and Family Consortium at the University of Minnesota. If you were not here this morning, this is a partnership that we have with MACMA to bring a day-long training to the annual conference each year. This morning we heard from Dr. Bonnie Klimes-Dugan about the neurobiology of adolescent mood. And if you missed that session, it will be available along with all three sessions today on our website. If you picked up a bookmark, our website's on that. Otherwise, it's cyfc.umn.edu. So you can view all of these presentations there later or refer them to your friends and colleagues. Please also join us this afternoon when Dr. Ann Garrity will speak about teens at risk, creating healthy relationships that regulate. The title of this workshop today is The Role of Lifestyle in Stress and Coping with Youth, and our presenter is Dr. Nimi Singh. I have several quick announcements that you've been hearing at every session now. Please remember to turn off cell phones. Please also complete the little green evaluation form and drop it in the box on your way out. This is our fourth annual series, and we look at those carefully to plan for the next year, so we really appreciate your input. We will be videotaping today's session, and I ask that if you have a question that you wait for the microphone. I'll try to run to you quickly and get you the microphone so that we can capture your question and the answers on tape. So I'd like to welcome Dr. Singh. She is an assistant professor and division head of adolescent health and medicine at the University of Minnesota Amplatz Children's Hospital, and she will say a bit more about her work before she begins. Welcome.
Thanks, Carrie. I'm really excited to be able to spend a bit of time in really getting into the details about the role of lifestyle and how that really impacts on mental health and well-being. And what I really want to emphasize is when you think about optimizing health and well-being, it really doesn't matter what the underlying diagnosis is. So no matter who you are and whatever age you're at, whatever diagnosis, whatever area of struggle, whether the individual is struggling with chronic mental health issues, chronic physical health issues, this is really about an approach that has benefit for the entire population. And there's a fair amount of data to suggest that it's really these issues that have gotten so out of balance for our patients and for the general population at large that are probably contributing to the rising rates of multiple chronic health conditions, many of which are chronic inflammatory conditions, such as asthma, eczema, autoimmune disease. And some people in the research world are beginning to include some cases of anxiety and depression in the chronic inflammatory response, that may really be neuroinflammation. And I'll talk a little bit about that. So we have to really broaden the way we think about what's going on when there's disordered cognition, when there's disordered emotional regulation, disordered moods. So I'm just going to quickly repeat one slide from this morning to get us back on track, and then really go into a fair amount of detail as to what the problem is in terms of the imbalances that we're finding in sleep, physical activity, the extent to which young people are engaged in recreational activities or not, and then some stress reduction strategies, and nutrition. And nutrition, really, I left that for the last because it's actually the most meaty part of the information that I want to share with you today. And then finally, even when we know that these things are out of balance with our patients that we're seeing, our clients, how do we gently and effectively lead them towards behavioral change? Because you guys know, telling your patient or the parents of your patients and clients to eat more fruits and vegetables and sending them on their way just doesn't cut it. And it may truly be a critical component of healing in the body, but we need to be able to be effective in the way we share information. So I'm going to pull in some motivational interviewing strategies. Some of you may have been trained in motivational interviewing. Many of you probably at a minimum heard about it. And what I'm going to do is just pull some concepts and give you some language around this particular issue so that perhaps you'll be able to play with some of the language when you go back and you're interacting with your clients. So as I mentioned this morning, we already have this amazing capacity to self-write. And again, let me give you another example. When I'm working with an adolescent, for example, let's say I'm seeing a young person who struggles with emotional dysregulation, anger management, explosive reactions around in certain situations. That may be someone who I then walk through an example of a time when they did regulate their emotion, or they did return back to normal consciousness, if you will. So it might go something like this. 15-year-old in the clinic, young man, struggling with mood. I may ask him, so tell me about a time, and he's told me that he has a younger sibling. So I might say something like, tell me about a time when you got really angry at your younger sibling for something they did. Just give me an instance. And I might hear something like, yeah, last month, my sister went into my room and borrowed my iPad, and she didn't even ask me, and it was just infuriating. I was looking for it for half an hour, and I couldn't find it, and then I walked into her room, and there she was with it, and it just made me really mad. And so I might say something like, well, I can see why that would be really frustrating. So can I ask you, I'm guessing you're still not talking to her. Well, yeah, I'm talking to her. Oh, okay. So how long did you stay mad when that thing happened? A few weeks? No. Several days? Yeah. Okay, so for several days you didn't interact with her, you didn't talk to her, you said nothing to her. Well, no, not really. I think I talked to her some of the time. Okay, so tell me exactly what happened right after that, you found out that she took your iPad. Well, tell me about that day. So they'll describe it, and then they'll come up with some activity that they were engaged in later in the day. And so then again, I go back and I say, okay, so your sister did this thing, and you were really angry at her, and then your friend came over, and you guys decided to go off and do something. So the whole time you're hanging out with your friend, you're sitting there thinking, I can't believe my sister took my iPad. No. And it's really the same example I gave you guys this morning. I point out to that young person, okay, so you gave yourself permission to put that story aside. And you chose to enjoy what it was that was in front of you for a period of time. And even though you've been struggling with having your anger flare up a lot and in lots of situations, it's not like you don't have the capacity to make a choice not to keep that old story alive. And then again, I point out, well, when you went home and you saw your sister, what happened? Well, I remembered that I was really mad at her. Okay, so you chose to turn that story on again, bring that to life again. Those are actually choices. And sometimes you're not doing it on purpose. Sometimes it just sort of happens, and then the reaction carries you away. I bet you're sick and tired of letting your sister yank your moods around like that. Wouldn't it be amazing if you could learn how to take that power back and not feel like you have to get triggered by her or that teacher or that kid at school or that situation? Well, you can learn to retrain your physiology. So that's where introducing to that young person that they have the capacity to shut off that reactivity is kind of the start. So then I might say something, and this is bringing in motivational interviewing. Well, what do you know about keeping a calm mind and really allowing yourself to function at your highest level? What does it take to really think clearly and well and be in control of your moods? And no matter what the young person says, you want to be able to say as truthfully as you can, wow, you know a lot about how to keep yourself in a clear state or functioning well. Well, there's some other things that might be useful for you to understand about this. Is it okay if I share those with you? So you're asking permission to share health information. And then you share the health information, and then you give choice. And you say, well, we know that regulating your sleep is really important in keeping your stress response shut off. We know that increasing the healthy vitamins and minerals in your body really helps your cells work appropriately and really help you shut off that stress response. We know that moving your body is really important. We know that finding time to do things you really enjoy is important. Which of those do you feel are the most out of balance for you? Or which of those would you like to work on first? And tell me about that story for you. What about your current situation do you think you could modify? Tell me how you'd like to modify it. When would you like to start? That sounds great. When would you like to come back and see me? Fantastic. That was motivational interviewing in a nutshell. I did not once tell the patient what to do. What I did was I gathered information about their situation. I asked if I could give health information back. I asked them what they thought about it. And mind you, these are in your last slides, but I wanted to start by addressing up front that this is evidence-based. There are over 300 clinical trials that have demonstrated the value of using motivational interviewing in assisting patients of all ages around health behavior change. And what I love about really addressing this component of mental health, particularly with adolescents, is it gives them a sense of mastery and self-efficacy, and it really is putting the power back in their court, if you will. And that developmentally resonates. You know, at a time where they're establishing autonomy and individuation, they don't want to be told what to do. But these are ways where we can get the critical health information to them in a way that feels like it's developmentally acceptable, and then they have the ears to hear it. So, thankfully, we all pop out of the stress response at some point, and we self-right psychologically, but sometimes we get stuck. So for our patients who are clearly dysregulated with their stress response, with their emotions, they're overreactive, we know that their stress physiology is easily triggered. Why does that happen? Why do we get stuck in the stress response? So yes, it's in part because the young person keeps playing old negative thoughts in their heads that they've played millions of times before that keep triggering their stress physiology. And teaching young people to recognize that and disengage from that can be very effective. But sometimes cognitive therapy alone isn't enough. So, you know, what else could be preventing them from shutting off the stress response? And we really have to turn to the rest of what the body needs for optimal functioning. And so it's critical that for all of our patients, somewhere along the way, that someone is taking a really good history to understand what is the sleep pattern of our patients, what's going on with their physical activity, what are they doing for enjoyment and to engage in activities that just allow them to forget everything and feel like they're enjoying themselves. And then finally, what's going on with their diet, and what do we know from the science about what is critical for optimal brain functioning. So I'll talk a little bit about micronutrient deficiencies, food intolerances, which is kind of an emerging area in medicine. The world of adult gastroenterology has sort of begun to adapt this, but here's a disclaimer. Food intolerances and this approach really started in the world of naturopathy, not biomedicine. And it really is about going back to basic nutritional science. So it's all science-based, but it's a philosophical approach that says, why are you out of balance now? Why weren't you out of balance, say, 2 years ago? Can we identify what puts you out of balance, and can we maybe put back the things you need to get in balance, take away the things that may be throwing you out of balance, and see what happens and see if you self-regulate? That is not the biomedical model. The biomedical model is, do you meet these diagnostic criteria? And if you do, which drug or which surgery or which therapy do we need to institute? And that's what we were taught. And yet there's this whole other piece that really, if we ignore it, it really is setting us up for failure for many, many of our patients. I'll talk a little bit about, I'll talk now a little bit about inflammation and the idea that inflammation, something that causes the immune response to turn on and act as if it needs to fight infection, actually stimulates cortisol and the stress hormones, cortisol and norepinephrine and epinephrine. And so you can have a patient who's actually inflamed, who has an inflammatory response going on, and that inflammation is actually irritating multiple areas in their body, including potentially their nervous system. So they have neuroinflammation that's actually causing their unclear cognition, that's causing their anxious thoughts or their depressed thoughts. And it's only if you look for and address the underlying inflammatory state and help to figure out how to shut that off, that the mood clears. So anxiety, depression, ADHD, those are descriptors of how the mind is not thinking clearly. It doesn't say why. And we need to ask the question why. Now, if we don't, and that inflammation continues, you can imagine if that inflammatory response never shuts off, somebody has an allergy and that hasn't been addressed, we can give an anti-anxiety medication, we can try to do psychotherapy, but that person is still struggling against that imbalance that may override and blunt any therapeutic effect that the treatment has. Okay, so obviously then in working with patients, particularly, who shows up on our radar? It's the patients whose treatments are not working. And the truth is we should be doing this for all of our patients in order to keep them in balance if they've luckily gotten back in balance after they've gotten treatment. But certainly for those patients who are doing really poorly, we need to understand what's going on with their sleep, optimizing that, their nutrition, their physical activity. The issue with recreational activities is you can't write a prescription, but you can say, were there things you used to do that you really enjoyed in your life that you don't do anymore? Tell me about that. Is that something that you would consider picking up again? And so reconnecting young people with activities they used to enjoy that maybe have fallen by the wayside is actually a way of engaging them with an activity where they already have neural circuitry laid down that gets easily triggered in terms of, oh yeah, I used to really enjoy this. When I do this, I forget all my problems and I just have fun. And I just get like a 20-minute break from life. So that can be a very effective adjunctive strategy, therapeutic strategy that doesn't cost anything, but it's reconnecting that young person with something that maybe was already helpful to them in the past or enjoyable to them in the past that actually can serve a therapeutic role. That's not to say that art therapy and music therapy anew and other creative therapies don't have a role, because those can be extremely powerful. I had a conversation yesterday where someone was telling me about a workshop that they attended, I think it was yesterday, with young people who really struggled with significant emotional and behavioral issues, where they were taught photography, and through that learning how to take photographs of nature, developing the film, doing exhibits, actually having adults come and kind of praise their work, it was absolutely transformative for these young people. So we forget that what in the world of adolescent health we call healthy youth development can be a powerful component of recovery from emotional and behavioral disorders. And then, of course, there are body movement therapies like yoga, tai chi, qigong. There are more and more studies that are beginning to show that these body movement therapies can be very powerful in retraining the body. What does it feel like to be relaxed? And what is it like to shut off the stress response for prolonged periods of time? And over time, when people learn how to shut off their stress physiology on a regular basis, their baseline stress response drops over time, and we know this from studies. And then there are other self-regulatory techniques that are often used, biofeedback, teaching folks self-hypnosis. So again, strategies to shut off stress, and turn on the relaxation response for prolonged periods of time. And then finally, cognitive behavioral therapies, which you probably know better than I do. But the way I summarize what cognitive therapies are, cognitive behavioral therapies, one person told me that it was really about problem solving and problem solving strategies. But to me, from what I've read, the most powerful component of cognitive behavioral therapy is teaching people how to recognize and disengage from their own negative thoughts. It's not coming up necessarily with solutions for future problems, but just recognizing that they're in stress-based thinking and stepping away from that and allowing their minds to clear, allowing that blood flow to come back up to the prefrontal cortex, and then being able to access stored information or new ideas that then allow them to problem solve in any given moment. Mindfulness-based stress reduction or other mindfulness-based therapies have been used in kids as young as 5 or 6. Really simple exercises that teach them to quiet down and notice their breathing or notice the sensation in their hands and their feet. Notice what they're hearing. Mindfulness therapies can revolve around teaching kids to take a piece of food, and when they put it in their mouth, what does it taste like? What is the texture like? Really getting them to focus on, with heightened awareness of the present moment and practicing that. When we do that as human beings, we're letting go of our stories and the chatter in our heads, and that alone can bring relaxation and relief. It's a very powerful technique. And then health realization, I shared with you a little bit this morning, that idea on focusing on the innate capacity to self-right. Okay, so sleep. There was this is probably not news to anybody in the room, because we know that not only are children sleep deprived, but there are studies to show that adults in this country, 75% of us are not getting adequate sleep. And guess what? We're role modeling this to our kids. And we now know from a 2003 survey that at least back in 2003, they estimated that 15 million children got inadequate sleep. And we know that sleep deprivation alone has been found to be prospectively a trigger for developing anxiety and can be a trigger for developing depression. And of course it works in the other direction. When you develop anxiety and depression, your sleep becomes more disordered, so then it becomes a vicious cycle. Here's the piece that shocks my patients the most. I say to them, guess what is the optimal time for being completely asleep, asleep at night, where you descend into the deepest level of sleep? And when I tell them it's between 10 p.m. and 2 a.m., they are horrified, because the majority of them are going to bed at midnight or maybe 1. And so they're missing 3/4 of that regenerative sleep. Our presenter prior to me this afternoon, Bonnie, talked about how we have these 24-hour rhythms in our bodies where during the day our cortisol or stress hormone is up, and our hormones that are associated with healing and growth and repair are down, and then it changes at nighttime. And in order for us to really experience optimal healing and repair and growth and replenishing of our cells with all the good nutrients that we need so that we're ready to use our brains in a fresh way the next day, all of those processes happen in the middle of the night when we should be completely inactive, and cortisol needs to be at its lowest level so that, again, growth hormone, something called insulin-like growth factor, are at their peak. And so, why is that? It's because the body has finite amount of oxygen and nutrients circulating, and it can either go into putting that energy into activity and, fight or flight, being externally engaged in the world, or it can be putting that into digestion, into healing, into repair, into growth. And the two compete. So when one's turned on, the other one's diminished. Now, so what interferes with this, particularly with our children and adolescents? So school schedules, after-school schedules, intellectually stimulating activities before bedtime. This is a huge culprit. And I did not put this on the slide, but it was a huge omission. I should have texting and cell phones on that list. So please write that down, because that's really the big struggle right now with our adolescents. We know that there's a really important peak of release of melatonin that is released by the pineal gland in the middle of this optimal time that we should be asleep. And that really allows us to stay asleep and in deep sleep for the rest of the night. Now, that melatonin surge is interfered with if we have light coming into our eyes and hitting the pineal gland. You basically blunt that melatonin response. Guess what light our adolescents are exposing themselves to at 12 o'clock, at 9 o'clock, at 10 o'clock, at 11 o'clock? When the phone rings, they reach the phone, it's 11:30, they're texting. That blue light is hitting their pineal gland, and they're not going to get that melatonin surge. They're not going to descend down into the deepest level of sleep, which is stage 4 delta sleep, that's associated with the greatest healing and repair. And then during that night, as long, it doesn't even matter if they sleep in the next day, they've lost optimal regenerative sleep. And that's one thing if you do it once in a while. But what if that's their night, every night, 5 nights in a row, and then they're trying to catch up on the weekends? But even on the weekends, they're still engaged in all those activities. So our adolescents are it's not just the hours of sleep. How many of you have had the experience where, for whatever reason, you had to stay up late, you went to bed at 1 o'clock in the morning, and you even slept in the next day, say till 11 or 12 because you were so exhausted, and you woke up and you still felt like a bus hit you? Why does that happen? You got a ton of sleep. You got the wrong kind of sleep. You missed the regenerative deep sleep. So hours of sleep do not make up for the quality of sleep, and that really matches with the body's 24-hour rhythms. They really need to be asleep at that time. People sometimes ask, well, what about adolescents? Aren't they night owls as compared to adults? Yes, that's true, but it staggers only the sleep pattern by about an hour. No more than that. For most of us, we should be winding down and getting into bed typically between 8 and 10. The adults. For adolescents, it's between 9 and 11. But really, the 10 p.m. to 2 a.m. is what I talk about in general. So that's a huge piece. When I see an adolescent who's struggling with an anxiety disorder or depression in the clinic, I'm asking about sleep and sleep pattern. And part of the treatment strategy is phone off and in your school bag in another room. TV out of the room. Computer out of the room. I've had parents tell me my child will riot if I try to do that. And then I come back and say, how much is your child struggling with their moods? How much do they want? And I'm having this conversation with the adolescent, actually. I say, well, here's information you may not realize. And I really go into the nerdy scientific explanation of the melatonin spike and the pineal gland and the blue light. And they're looking at me like, really? And then I say, my job is to give you information, and your job is to decide what to do with it. Is there something there that you think you could modify? What would you like to modify? How early do you think do a 1-week experiment. Just see how that affects your mood. That's one thing you could do. How early do you think you'd be willing to shut off your phone? When would you like to try that? When would you like to come back and see me? Do you see that when you say it that way, there's no resistance? And actually, all of those motivational interviewing techniques, guess what? They were developed with adults, because we do the same stuff. We don't like to be told what to do either. We come up with defenses and reasons why we can't change our health patterns when other people approach us that way. It's not just adolescents. This is a human reaction. And when people ask us what we think and what's going on in our lives and what we think could work better, we're much more likely to come up with a solution that we will actually implement, and it's associated much much more with successful behavioral change. So I don't want to imply that this is all about adolescent development and that's why they're fighting us. It's really, it emerges during adolescence, but it's not like it goes away. And if you don't believe me, just think back at a time when a kind, meaning relative of yours asked you, so are you still running? Or whatever happened to that exercise program that you started? Or, I know you were really doing X, Y, and Z for a while. How's that going? I mean, or worse, they come up and say, I started cycling and it's amazing and I finally lost this tire. You really ought to try it. What's your first reaction? It's, wait a minute, you don't have my life. You have no idea what my schedule's like. I would love to do that. I wish I had the time that you had. I mean, we naturally come up with the reasons why we can't change our lives. It's normal. It's natural. Ambivalence to change is the norm. But if that person said, I was struggling with this and this helped me and they told their story, that might create curiosity in us and we might ask more and then we might brainstorm. But when somebody tells us to do it, we don't like it. So I really want to emphasize that. Don't save this approach for your bad adolescents or your non-adherent adolescents. This is human nature. If we really made this our practice whenever we give health information, our patients would be so much more willing to hear what we have to say. Caffeine-containing foods and beverages. This is kind of stunning to me. This is also a huge cultural change that's occurred. So I'm going to date myself. I'm 50. I grew up at a time where I remember in my household, there was no way that I got to try coffee at the table. I mean, no, coffee, that was an adult drink. It was, my parents just sort of understood, that's a stimulant. No, you're not having that. I mean, I always thought there was something else, some ingredient that was really going to stunt my growth or something, because it really made it sound like, no, you can't have that. Now look at our culture today, and I'm not even talking about soft drinks. 12-year-olds are hanging out at Starbucks with their friends, having lattes. That caffeine's a stimulant. It's a drug. And you think about Red Bull, you think about all the caffeinated beverages that parents don't want their kids not to participate in the general culture, but these are interfering with sleep. When kids load up on stimulants during the day, and I'm not even talking about, borrowing prescription drugs or, that's a whole other issue, but just participating in everyday, the standard American diet, or what we also like to call the SAD diet, and I don't know, you guys have probably all heard that, but it's a sad diet, it is. And that's part of it. It's interfering with their sleep, so getting the caffeine out of their diet, addressing all of these pieces. I have had adolescents in my clinic who came in where all we did was address sleep and we tweaked nutrition a little bit and their anxiety disorder went away. No drugs, no psychotherapy. How many of those patients who are presenting do we miss that we just start on regular treatment and we're not even asking about these background pieces? So what helps? Limiting daytime naps. Physical activity during the day is a wonderful way of releasing stress and actually helps tire out the body so that it's ready to fall asleep at around 10 or 11. The sleep environment, really important for there not to be a lot of stimulating distractions around. So it really needs to be quiet and dark if our patients are lucky enough to live in housing and in circumstances where they have control over some of this. And then sleep routine is critical. A regular sleep routine, a regular life routine is hugely, hugely important to allow that natural 24-hour hormonal rhythm to function on a regular basis and really keep the body in balance. So, and that's really hard because so many of the young people we work with may have highly varying schedules throughout the week. It's amazing to me. I have patients who come in and tell me that, they're on a particular sport, they're doing a particular sport for maybe 3 months or 4 months, and it requires practice 3 hours a day after school, 5 days a week, and everything gets pushed back 3 hours. That's extraordinary to me that we think that it's reasonable for school-age young people to have a disrupted cycle like that for the sake of sports. Really, they couldn't get more out, as much out of it if it was 1.5 hours a day. I mean, 3 hours, it's just amazing to me what we've accepted is okay. And we have to step back and think critically, does this really make sense? And then here's the piece that's really challenging. So that same young person who's on the sports team, they come home, they're doing their homework, and they're grabbing dinner. Maybe it's 8 o'clock or 9 o'clock or maybe 10 o'clock when they're eating, and then they're staying up. How many of you have tried to address breakfast and eating breakfast with your patients, and they tell you, well, I can't eat breakfast because, I'm nauseated in the morning, I'm just not hungry? How many of you heard that from? It's really common for adolescents to not eat breakfast and to say that they're not ready to eat. Do you know why they're not ready to eat? Because they went to bed too late. They threw off their sleep-wake cycle, and their body is sending the brain is sending their body signals saying, no, you still need to be asleep. You're not ready to send oxygen and nutrients to your digestive tract to try to digest food. It's the reason why they're not hungry in the morning is they're that dysregulated. So the answer isn't force yourself to eat breakfast and keep sleeping the way you are. It's all interconnected. It's let's get your sleep hygiene taken care of, and you need to start putting in nutrition in your system. So I'll get to sort of what's an optimal breakfast. What do we know allows regular release of glucose in the bloodstream? Oh, I'm sorry, question. Back here.
Thank you.
Going back to what you were talking about, I've seen some research where they say if you wear yellow glasses, if you're doing computer work at night.
Oh.
Have you seen any of that? Because they said it blocks the blue rays from your screen. That doesn't affect melatonin release. And I was just wondering if you have seen anything or have any views on that.
I haven't seen that. That's interesting. No, I don't know. No, I'm not familiar with it, but that would be interesting. Now, there are times where a young person may have to stay up and do their homework, and if they don't do their homework, and they're going to stay up anxious at night if they go to bed with it, unfinished. No, but thank you. I'll definitely look out for that. Yes, please. Oh. Yeah, absolutely. Yeah, I didn't talk about reading, but boy, you know what? If it's a 9-year-old and they're reading Harry Potter for the first time, and oh my gosh, there's no way they're going to put that down. They're going to do what I remember doing, which is my mom would turn off the light, then it's the tent with the flashlight, and you're reading till whatever hour. Yes, so it can't be too stimulating. It can't be too addictive. Parents need to check in and say, done, and. But we don't think that it's stimulating to the brain in a disruptive way, the way screens, TV, internet, and phones are. And it probably is that light reflecting back. There's something about technological equipment that kind of does that. Any other questions about sleep? Yeah, a couple of questions. Yeah, that's a great question. So it probably has some effect, but again, we're talking about an hour here and there. The other thing is, the truth is, for those of us who live in different time zones, this sort of 10 p.m. and 2 a.m. being static probably is most true at the equator when there's 12 hours of daylight and 12 hours of night all year round, and then probably varies a little bit. We really do notice that we need a little bit less sleep during the summer hours, and we need more sleep during the evening hours, but we are nowhere near what I would say sophisticated enough in our cultures to truly honor yearly cycles and rhythms. There were cultures that used to do this, that really listened to the body's cues. That's optimal health, but I wasn't even going there. Because imagine, setting up a society where work hours change in the winter versus the summer. Now, you may work less in the winter, but you'd probably be working longer in the summer. But that would be really honoring what our physiology does in terms of the light-dark cycle. So great question. I'm sorry, somebody else had a question about sleep?
It was the same one.
Yeah, okay, great. Yeah, so you try to kind of simplify the message and you aim for that because most of our patients are so off that that's kind of a place to start. But your parents and young people may come back and ask you those questions, so you can sort of give them that answer. Okay, so in terms of physical activity, the last time I did a Medline search or a Google search on all the studies that have been done to show the beneficial effects of physical activity on mental health, I came up with over 18,000 studies. And we barely pay attention to these studies and this research. We were designed to move our bodies, and it is critical for detoxification. It's critical for circulation. It's critical for, at the talk that Bonnie did before me in this room this afternoon, she mentioned the book Why Zebras Don't Get Ulcers by Robert Sapolsky. And the story is when animals are attacked by predators and they have the stress response, if they survive that attack, they get away or they're minimally injured, they'll go off and actually shake violently to dispel that burst of energy that got sent to their heart, lungs, and muscles. And they'll dispel it completely so that they can then walk back to the herd and engage in normal activities. And when they're observed in nature kind of studies, they act as if that attack never happened. So they recover very quickly. They dispel that extra energy. And the other thing that animals don't do that we do really well is we have these amazingly intelligent brains that can think in sophisticated ways. The prefrontal cortex allows you to engage in abstract thinking and future time perspective and linking cause and effect and creative problem solving. But we also like to hang on to our stories. And the zebra doesn't go away for the next 2 weeks looking over its shoulder like, where's that lion coming from? Oh my gosh, I'll never trust a lion again. And I'll never trust my herd for looking out for me again because you can't be trusted. And, they don't do that. That lion story, that lion attack is in the past, and they're back to present moment awareness. So their stress physiology doesn't get revved and prolonged and doesn't disrupt their GI tract and all their other functioning. We human beings, on the other hand, with our wonderfully intelligent brains, unfortunately hang on to those stories and inadvertently can fall into patterns where we keep playing them, which then triggers the stress physiology as if that insulting event, traumatic event is happening all over again, and the physiology gets thrown off. So getting back to physical activity. So what is the best exercise? One that the individual enjoys and will maintain over time, and that's the bottom line. So any form of moving the body that the young person is interested in, curious about, loves to do, used to do, but then stop doing, you want to reconnect them with some way, shape, or form of physical activity. And I make it really easy for those patients I see who do absolutely nothing and have never engaged in sports. I was that kid. I was all about my books. I was barely moving my body. I don't know how I got away with that, except for, minimal. Well, actually, gym was required. And it was required from 6th grade to 12th grade. You didn't get out of gym. It was twice a week, and you had to go. And now we've done away with that. It is so critical for us to role model and to make sure that kids are moving their bodies. So what I'll do for the person who's really physical activity averse is I'll really start by saying, do you think you can find one time in a week, once or twice, where you can walk for 15 minutes and not because you have to walk to class and not because you're walking in the mall, but you're walking for the sake of walking? Now, why is that important? To me, I now understand this. It's tricky. It's a way of getting somebody to engage in mindful walking. What you're doing is you're getting them really focused on the activity. They're putting on their walking shoes, whatever walking clothes they're going to have. And you're saying for 15 minutes, that's your purpose in life. It's just to focus on your walking and really walk to the point where you feel like things are moving and you're not getting out of breath, but you feel like your body is actually working a little bit. And when you finish those 15 minutes of walking, you should feel like a humming or a buzzing in your body that tells you that everything's kind of alive and vibrant. Can you do that maybe even once a week? So let's brainstorm. Where can you do that? Where's a safe place for you to be able to do that? You really walk through the concrete. Are you interested? Where do you think you could do it? What time of day? Is that a safe place? Do you have walking shoes? Fantastic. Let's see if you can start that. And then you build on success. Do you want to do that once a week, or do you want to do that more than once a week? And then as somebody starts doing that, you say, great. How's that going for you? Well, once I got going, it just seemed really silly to do it for 15 minutes, so I went for 20. And then you just keep expanding. So that's how you can begin to introduce physical activity. We know the benefits of physical activity on health don't have to be intense aerobics. Simple walking 20 to 30 minutes, ideally 2 to 3 times a week, can have health benefits.